Hey everybody, today's video is all about IT band pain. So your IT band, if you haven't heard of it, is basically a long band that runs down, can't really see my thigh here, but the outside of your thigh. If you press along the outside of your thigh, it usually feels like a real tough band, and for some folks it's a little bit tender. So it's going to come all the way from your hip bone on the side, where you can feel your hip, down towards the outside of your knee. So in the video today I'm going to talk about kind of what the IT band syndrome is, or what causes irritation of that IT band, and then I'll tell you what you can do about it too. So we're just going to lump that all into one video. So first off, IT band irritation, usually you see it in people who are pretty active. So cyclists and runners are the two most common ones, and the reason is just mainly associated with the anatomy of the IT band. Again, it's starting up by your hip and pelvis area, and then it's running down towards the outside of your knee. It's going to attach kind of into your lower leg and then to the side of your kneecap. So if you imagine that IT band running along the outside of your knee there, it's rubbing across a little bone right on the outside of your knee. And so as your knee bends and straightens, it just kind of goes back and forth over that little bone there. So if you look at like a cyclist who's constantly bending and straightening their knee as they ride their bicycle, or the runner who's constantly bending and straightening their knee as they run, that's when you get a lot of IT band syndrome. Doesn't mean it can't happen to the average person like you or me who just is active in general, or depending how active you are really, but it can happen to anybody. Fairly easy to diagnose. For some people, they're going to have like a clicking noise on the outside of their knee, and you could almost feel it like rubbing against there, and you'll feel pain right there. And then for other folks, easy diagnosis if you just push along the IT band, typically down close to the knee. For some folks, it's more like middle of the IT band. So if you're right along the outside of your leg, your thigh there, and it's tender, that's usually your IT band. Go up a little farther, and a lot of folks will have that pain into the side of their hip, more like a bursitis type pain, or even into their buttocks, which could be a couple different muscles or things like that. So again, fairly easy to diagnose from my perspective as a therapist. We look at it, one of those things we're like, well, does it hurt here? Okay, that's it then. So that's kind of what causes it. Other things that can be related to that cause are changes like in your biomechanics of the leg. So if you look at like a normal biomechanical movement of the leg, it's in good, neutral alignment, all sorts of things, details there. Anything like that can throw it off. So if you're out of alignment, or you've got some muscular weakness like in your hips or your knees, things like that, that's going to be an issue in terms of the cause of it. So when you look at treating IT band pain, there's a couple things you want to look at. So with this kind of stuff, first off, you're looking at how can you relieve the pain. That's kind of step one. So relieving the pain, you're going to do like IT band stretches, which is kind of a weird stretch where you cross your leg and then lean to the opposite side. You're going to do some self-massage if you're treating it yourself. If we're treating you in the clinic, we're going to do more like friction massage and things like that to get the tissue to heal and get it to elongate and things like that. Using ice is usually typically pretty helpful as well, since it's inflamed, especially there on the outside of your knee. If it's real inflamed and it's kind of clicking and it's really bothering you, you can use ice. The biggest thing in treatment though overall, and I kind of jumped ahead because we're talking about like relieving the pain or lengthening the tissue, whatever you want to do. The biggest thing is to figure out really why it's bothering you in the first place. So again, go back to your biomechanics. When we're treating people in the clinic, we're looking at, okay, well, why is the IT band irritated? So obviously it's irritated because it's been used too much. It's constantly rubbing against that bone. But for a lot of people, they're going to have like underlying hip weakness, and that's throwing off the mechanics of their leg down as it approaches the knee joint, and that's throwing off the mechanics of the knee and causing the IT band to rub more. So just treating the pain with things like icing, stretching, massage, self-massage like with a foam roller or a massage tool, that's only going to get you so far if the underlying cause is still there. So again, just look at the underlying cause. It could be weakness of the knee, it could be weakness of the hip and core, it could be a training error that you're making if you're running or cycling, and it could be something related to your ankle alignment and your arch support and stuff like that. So whenever you're working with a knee in general, or especially a tissue and a structure like that T-band that's actually crossing your knee and crossing your hip, you just want to be aware of those things above and below. So that's really how you want to, that's where you can have the most success with treating that T-band pain, is figuring out where it's coming from, and then you jump into, okay, pain relief followed by strengthening of the appropriate muscles, training adjustments, biomechanical adjustments, and then trying to maintain those gains you've made, and then get back to the active, cycling, running, chasing your kids around, dancing with your spouse, whatever it is you do. So that's IT band pain in a nutshell. One last word I will make on the massage. It's one of those things where it can be kind of a chronic issue if you're not careful. So for a lot of folks, if they get to the point where they can tolerate some self-massage in the form of like a foam roller, they might just do that prophylactically ongoing. Just do some self-massage, especially runners and cyclists. Again, if you're going to be that active, you want to do some self-massage anyways, not just of your IT band, but of things like your quads, hamstrings, calf muscles, stuff like that. So doing a little bit of your own body work, as it were, is going to be important. So if you're trying to do some self-massage at home, foam roller where you're laying on your side is fairly aggressive. If you're in a lot of pain, it might not be the best place to start, but there's other types of self-massage. One of my favorites these days are like the big massage rollers. I should have grabbed one, but they look like rolling pins. We've got 3 different varieties at the clinic. My favorite one has like 5 spiky blue balls on it, and it looks kind of like a torture device, but it's actually quite comfortable, and you can just massage yourself. You can massage your hamstrings, you can massage your quads on the front of your thigh and stuff like that. So that is an important piece of the ongoing management. But again, just appreciate that if you don't address the underlying cause, more than likely you're just going to be treating symptoms, and it's going to come back over and over again, just kind of cyclically. So that's the video for today, all about IT band syndrome, how you can treat it, what to do with it. If you have any questions, please reach out to me. I'll leave my contact information under the video. Thanks for watching.